Right, so Liz and I are going to talk about a little bit of the troubleshooting around catheterization for both males and females. And also, I mean, you'd have much more experience with this, but the commonly asked questions from parents and caregivers as well, which come in their droves, obviously, and you know, for good reason. But I suppose maybe if we start with some of the troubleshooting, and one of the things I suppose that's often mentioned is the risk or the perceived perception of pain with something like catheterization. Now, this doesn't occur with all patients, obviously, but
no.
I mean, how do we minimize it?
So depending, obviously, what's wrong with them. So depending if you have a child with very little sensation, catheterizing is very easy for them and for the parents. In that situation, it's not such a daunting task. However, with that, if your child has little or no sensation, I suppose your risk of a trauma or a little nick or if you were a little bit forceful with the catheter, is if they can't respond to that. So that's something, especially with the boys, and that's leads you to your risk, I suppose, of false passage and a little bit of damage to the urethra and over time. But on the whole, CIC is a very safe practice. So if your child has a completely normal feeling and normal sensation, their initial reaction is, I'm not sticking that in, you can't stick that in. And it can often be hard when somebody comes towards you with a catheter and they will back themselves up the bed, they will tense all their muscles. If you are tensing your muscles and tensing your pelvic floor, so
ironically, it's going to make it worse. Yeah,
it's going to make it harder as your water pipe, your urethra comes through your pelvic floor. So if you squeeze your pelvic floor, you squeeze your urethra shut, so your catheter will meet resistance and it will be uncomfortable and quite often painful for them. So relaxation is the key with catheterization. So working on that before, when we get somebody who needs to learn to catheterize, we often start very slowly. Some people will progress faster than others, and depending on how urgent the catheterization is, gives your window of how fast we need to progress it. But quite often we will start with, have a look at your anatomy, have a look in the mirror, watch as mum or dad catheterizes, watch in the mirror to see where it's going. Get used to your own body. Also, one of the other big factors is your breathing, your distraction techniques, and control is a big issue. When they can often feel that somebody else is in control of what's happening. So helping hand over hand with whoever is doing the catheterization, and give them a role in the process. So let them open the catheter, start them with their washing their hands when you're washing your hands. So bring them along with you at every step. It's quite an intimate procedure, and you need to have trust with the caregiver, and even as a healthcare professional, it's a big part of it. You would never just launch in on a child to just say, you know what we're going to do now. So it always takes time. We give them dolls, we give them some catheters, let them feel them, let them play with them. They have to know what it is, how it works. Let them catheterize a doll, take it home, go home and do a little work at home. So quite often what we would get them to do, depending on how upset or distressed they are, is even start by desensitization, which is just, on the skin of the thigh, and that's it. And every day with your fresh catheter, maybe you just get a little bit closer, and eventually they'll get in closer. And again, it's all about sensation. How does it feel for the child? So it's not a painful procedure, but if you have sensation, how would you describe the sensation, Fardod? It's a hard one.
It's weird and uncomfortable for a second, I suppose. I suppose if I was a parent, I'd be concerned that, my child is going to get pain every time I feel this, but that's not necessarily the case at all. No. So it does happen in some cases if you have a sensate bladder neck, which just means because some kids don't have that, and if they do have that, it can feel weird. And I suppose the big thing is just making sure that as you said, they're as relaxed as possible, because if they're not, it's just going to make things a bit difficult. And so education is a huge part of this then.
Yeah.
When they're doing the CIC or the clean intermittent catheterization.
Yeah, absolutely. We find as well, the younger it starts, the easier it is to do it. Introducing catheterization at an older age can be harder, but it's it's doable. It really is doable. So yeah, their level of trust in the procedure and the person doing it is significant.
And I suppose this is where it comes in that we were talking about catheter sizes on previously. Yeah. This is where one size doesn't fit all, yeah. and therefore you might actually be trying to figure out, well, what actually suits me.
Absolutely.
Can we bring on the idea of urinary tract infections? This is what worries everyone about this. And I suppose let's go straight off the bat with this, and it's the elephant in the room. If you are self-catheterizing, or if you're being catheterized, you're going to have bacteria in your urine. Yeah. It's going to happen. So I suppose one of the biggest changes over the last few years now is, and I'm really curious to know how you feel about this, the idea of just taking a sample just in case.
Yeah.
What are your thoughts?
So, as you said, bacteria in the urine is absolutely inevitable when you're catheterizing. If you have no symptoms, why are we taking a sample? So, often as well, if you attend an out-of-hours service or, somewhere that you're not known, if you are catheterizing, quite often you must have a UTI.
Yeah.
So antibiotics, quite often people are given antibiotics when they don't really need them, and all that does is open you up to developing resistance against these antibiotics, so that when you do have a true UTI, you're in trouble. That your options may be a lot narrower than they were if you were not taking antibiotics on the just in case basis. So I suppose we're looking at true symptoms of UTI. So I would say the biggest when they're catheterizing, a foul smell from the urine, cloudy, if you can't see through it, are you dehydrated or is there something there? Blood in the urine, feeling unwell, abdominal pain, no appetite, increasing lethargy, and the biggest one then obviously high temperatures.
Fever. Yeah.
So at that case, definitely a urine sample. Now for samples, a catheter specimen is ideal.
Yes.
So your jar is sterile. Ask your healthcare provider for a few so you've got them at home. You're going to catheterize as normal. Allow the first bit of the flow to come out, and then you're going to catch your sample midstream, basically, and then you're going to get that to a lab. A urine dipstick, Fardod, what's your...
Yeah, so this is something that has actually changed in recent years. So certainly now, if we look at the European Association of Urology and the European Society of Paediatric Urology, what they would now suggest is that to diagnose a UTI, you probably need three things. You quite rightly mentioned clinical symptoms and signs, a positive dipstick, and a positive culture. Yeah. And if you're missing any of those three things, then I suppose we got to question whether it's a true UTI or not, because we just saying, oh, well, look, there are some white cells on the dipstick, we'll just give antibiotics just in case, I suppose is really difficult sometimes when you've got a kid who may not be able to verbalize what's going on, but we just have to be really careful with our stewardship here, I'd say, in many ways. But so, the three things we're looking for are that triad of clinical symptoms, positive dipstick, and positive culture. So what do I feel about the dipstick? I think it's really useful. Dipsticks are really useful when they're negative, really useful. But if they're positive, it's just part of it.
And you've got to go to the next, so we would always educate people around antibiotics as a prescriber, especially. We like families to be able to advocate for themselves as well if they arrive in an out of hours GP or they arrive they're on holidays and they end up somewhere that they're not known, that they're able to say no, yes, he's unwell, or the child and the parents will know their symptoms like the back of their hand. They will know, and everyone's symptoms are slightly different. So when you know the patient, you know when you should be going in with treatment or maybe not. So that again is the relationship as well. But again, when you attend someone who doesn't know you and err on the side of caution, you're given an oral antibiotic. So samples are your key, really, just to know where you're at.
Absolutely, because they also allow you to, I suppose, in many ways, compare one sample against the other and just look and see what's happening. Exactly. Okay, so that's UTI. So they are at a slightly increased risk because they are introducing hardware in, but that risk can be minimized, and not every symptom that you see is going to be a urinary tract infection.
And I suppose we have to look at the reason why we are catheterizing.
Correct.
We're catheterizing for someone who possibly is not emptying. Not emptying is one of the biggest risk factors for developing a UTI.
Exactly.
You've got stagnant urine, it's nice and dark, warm and wet in the bladder.
100%.
Bugs are going to multiply, take over, and that's where your UTI is going to happen. So if you are emptying more effectively, ideally, you're reducing your number of UTIs.
Correct.
So
I agree.
it all
Agree.
comes full circle.
And also the other thing just to bear in mind, given this cohort of patients we're talking about, and I know that's not really the focus of this particular educational video, but bowel management is going to be important here as well, because if you don't manage the bowels appropriately, that will also increase the risk of UTIs as well. So I think we have to take a holistic view when we're talking about this stuff. But we're going to focus on the front end, I guess, for the time being. One of the big things that you'd often get called about would be, oh, I've got blood in the catheter. What do we do?
Yeah. So blood in the catheter, quite often, even when I have catheterized a patient, I take the catheter out and the parent will say, oh, it's bleeding. And you say, if you see a little bit of blood just at the tip there, your urethra is quite vascular. You've got a lovely rich blood supply there. So yes, a little bit of friction, and especially at the bladder neck as well if it's a little tight. So you can cause a little bit of friction. I always tell them, if what's coming out is kind of, sometimes the urine might look a little rosé, which tells you there is some blood in there. If what comes out is bright red, fresh bleeding, that's when you need to seek attention, seek help. You need to, you need to contact.
Clots maybe?
If you see small little clots, you might sometimes see a little streak in the urine. Again, if they were moving about and if it wasn't such an easy, like our patient here, if they weren't lying so nice and still on the bed for you, if they're hopping around, if you're struggling a little bit, yes, a little bit of blood in the urine is no harm. So keep well hydrated, flush out the bladder, and keep an eye. If it's persistent, yes, by all means, then we might look at things. But in general, and on the whole, it's not a big concern.
No. So I guess as parents or caregivers, your mind races straight to something really serious with this, and usually it's not.
Or I've caused some damage.
Yes, exactly. Yeah, absolutely. But
so
this,
it's just it's confidence in it as well, and then as you get used to it, you're able to troubleshoot quite a lot of that yourself. You're able to say, no, I know what that was, and all is good.
And I suppose the other reason as well is if you had persistent blood in the urine, it may not actually be coming from your bladder at all, depending on what your background history is as well. So it's always good to get checked out and just make sure everything is okay. But for the most part, these are okay. If we go slightly off topic, I mean, one thing that on the same theme, one thing that often comes up is, well, you're doing this with an adolescent or a teenager, and they've started their menstrual cycle. I mean, is that a concern? Can you catheterize if you've got your period?
Absolutely. Okay. Catheterization during your period is absolutely fine.
Okay.
Is it a little more awkward? Yes, absolutely. So again, it's all about the cleanliness. So you've got to just make sure you clean the area well before you catheterize, because again, all it is you don't want to be introducing vaginal flora or bugs up into the urethra, into the bladder. But again, it is not a concern when you have your period. Some of our older girls would use tampons, which again will keep everything nice and clean, and actually then gives you a very good run into when they're catheterizing. And
would it be true to say that you might have an increased likelihood of getting some blood on the catheter if you were doing this during
Absolutely. So again, looking at that's inevitable, really.
It's just the bigger picture.
Yeah, it's the bigger picture, but it's not a problem.
Okay, fair enough. Shall we talk about a few common questions with this stuff? So I suppose in terms of troubleshooting, and I was going to kind of talk about this during the troubleshooting, but I think it's such a commonly asked question as well that we might as well just address it now. Yeah. What do we do if a parent or a caregiver says, I can't get the catheter in?
Yeah, okay. So we would get this, especially when you start. Yeah. It can be difficult, you're learning. So And sometimes in a controlled environment, when you're in the hospital and you've the safety of your nurse, your doctor there with you, you go home and sometimes you think, oh, I've forgotten, or am I doing this right? So depending on what the reason for your catheters are, generally you are safe to just step away from it for an hour. Give yourself and your child a bit of a break. So if you keep and you persist and you keep trying and jabbing, and things are going to swell, there'll be a little bit of edema, and that will make things more painful and more difficult to get it in. So in the event that your child cannot actually, if your bladder fills, it's going to make its way out. Yeah. So what's the worst that, your child, if the bladder gets too full, you haven't been able to catheterize, that your child just may be wet, which is safe.
So that's overflow.
They're safe. Yeah. If they're going to, until you can get somewhere that you may need you may need your nurse to give you some support with it. But always, just the main thing I suppose is that you don't keep trying in vain if you're not getting it. Just come away from it, let everything settle, let everyone settle, because if you're not getting in, chances are they may be uncomfortable and the stress might be quite high. So just step away from it, come back and try again. If not, absolutely seek help from your healthcare provider.
Yeah, and it's really interesting that you mentioned that, because one of the things that I often get asked or get, I suppose, told is that, especially with teenagers, compliance can be a bit of an issue. So they're supposed to be catheterizing whatever their healthcare provider said 4 or 5, 6 times a day, and they've thought otherwise. Yeah. And they're wondering, is that okay? Can I just do that? Can I just catheterize when I feel I need to go? And I think that in many ways can be a little bit dangerous because I would always recommend that if you're giving a timetable to follow, it's there for a reason, and therefore you should just go with that. So it's not the end of the world, as if you, like you said, if you miss a catheterization because you couldn't get it in or something like that. But I wouldn't let that become a regular pattern. Yeah, no. Because overflow will get you out of trouble. But saying that it's not a normal pressure for the bladder to be slightly raised, and you don't want this be, as you said earlier, leading to things like urinary tract infections, potentially some blood in the urine, and then causing stress and anxiety as a result. So compliance is really important with catheterization, especially as kids get older. But one of the things that I'm curious about is who can catheterize, and when can they catheterize, and how do you go about that? Do you need training for it, or how does that happen?
We tend to train the parents. Parents are the main caregivers, so we will train either one or both parents, and they get their confidence up. They become the expert. There, from then on, it's a train the trainer situation. So often with schools, we ask them to liaise with the school, meet the SNA, and go in and train the SNAs in the school. Often there is training provided by a healthcare professional for SNAs, but the practical is always done by the parent. Right. So the parent is then in a position to train a family member who might look after the child after school, a family member who they might go for sleepovers with. So keep your circle, I would always say, keep your circle small. Right. It's something that you're not going to have an awful lot of people doing it, but it means you've got the safety net that if you are the only one doing it, you've got to think of quality of life for the family. Right. So you've got to have that backup, that you've got somebody that can come in the event that something happened or you broke your arm. You've got to have your village around you that can come in and catheterize. But there is training there. We are always happy to take, if people are struggling, we're happy to take them in and help them out. But definitely it's always, the parent is the expert. They've been trained by the healthcare professional, and then they go off and they will train their trusted people. And
I suppose it's fair to say that sometimes you might need retraining.
Absolutely.
It's things
as
can
they
happen.
Grow.
And as kids
as
grow.
They grow.
Exactly.
Especially with the males as they grow, and the urethra grows, so things can change. Absolutely.
Brilliant. Liz, I suppose one common thing that tends to come up a little bit is some parents sometimes say, well, my son or daughter, whoever it is trying to avoid drinking a little bit so that they don't have to catheterize as much. And I suppose this brings up an important point, because bladder cycling or your bladder emptying, it needs to happen whether you're dehydrated or not. I mean, your kidneys, absolutely, your kidneys are still going to produce urine. They're just maybe going to produce a different type of quality of urine, a bit more concentrated, but it's got to come out. I mean, so what are your thoughts on things like hydration and stuff?
So we would always advise that you keep keep yourself well hydrated, and we tend to work on the school day because that's their work. That's the longest part of their day, and if they're not drinking or eating in school, they're going to run into difficulties. So we like to keep them on a cycle of you have a drink and a catheter at breakfast, twice in school, again in the afternoon, and the evening or bedtime. Again, depends on the length of a child's day. But ideally, you want to be having at least 500 mils of fluid evenly split between your breaks over the day, over the course of the school day, and that keeps it quite manageable for them. If you ask them to drink,
school,
in the school day, because at least if you've got that, because quite often we find they've come home from school and their bottle is full, then they're playing catch up between the late afternoon and bedtime, and you're never gonna get there. So to keep yourself and your bladder on it, and also for brain function, for attention, their fluids, your water is vital. We can't get away from it. So it's that simple cycle of just to try and keep it to blocks of time for them.
So we need the bladder empty. We need, whether they do that themselves or whether they're catheterizing, it has to empty and it has to cycle. We've got to get that waste out of there. And we've got to replenish it with fluids coming in. And I suppose there are ways we can calculate how much fluid a child will need during the day according to their weight. So, and your healthcare provider can obviously go through that with you. And the other thing I suppose just to mention as well is that there's a myriad of literature out there on this. And, we've got examples here. I mean, these are just two-hand, they're handy, but, even things like where they're kind of showing different steps, on how you go. And I suppose if you're ever unsure, you just contact your healthcare provider over this, and if you need to see it be referred on to the specialist, then by all means, you may already be linked in with the specialist. In fact, you probably are, if this is what you're doing.
This is where we are.
But there's always someone there, so you're not alone. And
no question is silly.
No, absolutely not.
And never be afraid to ask anything, because that's why we're here. It's really, rather than sit at home and wonder, oh, could I ask that or should I ask that? Just ask it. Always ask it. It's just so much easier.
Or write it down and ask it the next time. Yeah, absolutely.
Because CIC can just, your quality of life can skyrocket when you are successfully catheterizing.
Totally.
So
brilliant. So Liz, I suppose you're a parent and you're in a clinic and you've just been told that something that seemed so reasonably mundane and reflex your entire life, such as peeing, is now something that's going to have to be managed with this thing called clean intermittent catheterization. That's a shock, I suppose, if it comes up, and it's not a common thing, I guess, but it's not something that, well, we see it a lot, but it's not something that you wouldn't see in the community or within wider circles. And I guess it's a little bit more common than you think it is for a number of different reasons. But how do you process that at the start?
Yeah, it is quite a daunting task to ask anyone to do CIC. And sometimes I think we're a little bit, we've got the answer. We know it's going to work really well. But when you're telling the parent and the child, you know what, we're just going to take this and we're going to put this catheter into your bladder and all will be well. So you've got to approach it. You've got to approach it very slowly, and the education is key and the support is key, because and I know, as we said, while it's common, we see it a lot, but it's not something that's discussed openly
No, it's
among
not.
peers.
No,
You're not
definitely
in
not.
school saying, guess what I do?
Yeah.
And so the whole kind of keeping things under wraps and the fear of, how am I going to do this in school? What if a catheter falls out of my bag? How am I going to go out? How do I go out with my friends? So all of these things, especially for the older children, will be churning and churning and churning, and we haven't even got to the practice of it yet. So I think your literature, you're having the frank, honest conversations with your nurse or your doctor are really, really important. While it is, as we said, quite a daunting thing for a family to take on, once you get there, it just opens up, it can open up your world quite significantly. Yes, there will be bumps in the road. Will there be the odd UTI? Will you struggle at the beginning? Everybody does to some extent, but that's life really. And you know what? We are here and we're here to support. And so there's always somebody at the end of the phone, and there's always the option to come in and, you know, we might need to tweak something. But yes, I think it's very doable, but sometimes how do you eat the elephant? One small bite at a time. So you've got to get there, you've got to take it slow.
And I suppose, with something like this, I guess the way I often look at it is we've got to think of the bigger picture as to why we're doing this. We're doing this to protect the child, and we're doing this to keep everything as reasonably routine as possible. And I think routine is key. I mean, I often think of, you know, you teach children with some resistance sometimes to brush their teeth. They just get into the routine of doing it. They do it twice a day. This is a little bit more involved than that, but it's the same habit.
Exactly. It's forming habits. Yeah.
And I suppose with various tips and tricks, you can kind of see how you might be able to do this a little bit easier, just to make this a bit less daunting than, as you said, and we can talk about maybe a little bit about a bit of troubleshooting and commonly asked questions, and then we'll you know, the advice is always, if you're worried, this is going to be a shock, but if you're worried, then seek help.
And you know what? Reassurance is huge. People just need to be told you are doing everything you should be and could be doing. And you know, that people are aware. It's okay if it doesn't go right the first few times. Just don't panic.
Yeah.
You will get there.
Great. Thanks so much, Liz.